Well, about 1 out of every 8 men will be diagnosed with prostate cancer during his lifetime, with non-Hispanic black men being at highest risk.
And about 6 in 10 cases are diagnosed in men who are 65 years or older. In tonight's Health U, Intisar Faulkner chatting with the doctor to discuss a new treatment with Lexington Medical Center. Prostate, kidney, and bladder cancers are 3 commonly diagnosed urological conditions at Lexington Medical Center. The hospital is using a variety of new technology to diagnose and treat these diseases. Our guest today is Dr. Terence Chapman, a urologist with Lexington Urology, a Lexington Medical Center physician practice, and the medical director of urologic oncology at Lexington Medical Center. Thank you so much for coming on, doctor.
Thank you for having me.
So all of those conditions that we just mentioned could be considered as part of a subspecialty called urologic oncology. Can you explain what that is?
Well, if you could imagine that urology is a specialty, urologic oncology would be a subspecialty within that deals with most of those cancers that you just mentioned.
And what exactly is the most common urologic cancer that you see?
By numbers, prostate cancer. So the latest estimate is about 1 in 8 men might be diagnosed in their lifetime. And that equates to about 288,000 estimated cases this year. And
how is that treated exactly?
Well, if we even back up a step, we might see people who are referred with a lab test that's abnormal called a PSA. And we might take a look, and we have some very sophisticated diagnostic tools now where we may do studies like an MRI to see if somebody might need a biopsy. And if so, that MRI information can be incorporated into the biopsy in real time, which is a very accurate way of doing it. And some patients may not even need a biopsy, and that's where the MRI can help.
Well, what urologic oncology services does LexMed offer?
Well, we have the comprehensive range of diagnostic and treatment technologies, and also the people, right? So doctors who are with extensive training, but also it's a team approach. We have nurses, we have technicians, and the whole staff, so it's a team effort, very important. We also have an approach we call a multidisciplinary approach, which means we meet every 2 weeks, and that's all the doctors who are involved with cancer care. So we meet, and so if you become a patient, you are actually connected with all those people. So that becomes the way that we treat everybody, is that we follow nationally published guidelines, and we incorporate all the other specialties as necessary.
So after these procedures, what exactly happens after surgery?
Well, so if a person who is diagnosed with prostate cancer, for example, they may have a choice between surveillance, which is no immediate treatment. They may be able to be observed carefully. Some patients may have surgery. Some patients may choose radiation. For example, if you have an operation, we have what we call robotic technology. So it's an enhanced version of laparoscopic surgery. And it's only an overnight stay, small incisions, minimal blood loss, so people get back to their normal selves very quickly. And so, that's the main advantage that you're going to see. And then, there's recovery afterwards, and that people would be able to get back to their normal way of life within 4 to 6 weeks without restriction.
Dr. Chapman, how could this service possibly help those with kidney cancer?
Well, so that's a good question. So the most common way that we encounter that these days is people who have had scans done for some other reason. Oh. So we call that an incidental finding. So sometimes patients have symptoms. They may have weight loss, pain, or blood in the urine, but that's actually a lot less common.
And talk about how your colleagues can use this treatment for bladder cancer as well.
Well, so we similarly, I mentioned the robot for the prostate. We'll use that for kidneys as well, and we try to spare part of the kidney if we can. We may use it also for patients with bladder cancer, but patients with bladder cancer, there are really 2 types. There is one that could be what we call non-muscle invasive or superficial, or one that's muscle invasive that's more serious, and they have a little bit different treatment approaches, but it could involve a minor surgery and some medication, and monitoring. And we have some very modern monitoring system where we call blue light, where we can see things that you can't see with normal light, which is a very impressive technology. We also have choices where if a patient has a more serious cancer, they may require chemotherapy with either surgery or radiation.
And lastly, doctor, what can patients do to prevent these conditions?
Well, if you smoke, you can quit smoking. That's the most important thing. It's never too late to quit. And I think that mainly the advice I give most people is trying to reduce your number one risk, which for most people is going to be cardiovascular disease. And so we try to impart the concept of good metabolic health, okay, which means trying to eat well, less processed food, eating maybe in a shorter time period each day. Those things can help contribute to better cardiovascular risk, including lower weight and those kind of things.
Dr. Chapman, thank you so much for sharing this information. For more information, visit Lexington Urology's website at lexingtonurology.com.